My name is Dr. Claire Moffat. So I currently work in child protection, so for the Department of Communities and Justice, mostly in a research role, but previously I've had some academic experience and more clinical research experience. Since starting my PhD, you tend to have jobs during a PhD just to kind of put food on the table. So through that process, I have worked as a research assistant, so both in a community rehabilitation centre and for a neurosurgery and neuropsychology research group. I then went to do some work as a clinical research coordinator, and that was in a research project focused on improving mental health outcomes after traumatic brain injury. And then through that process as well, at the same time, I was practicing as a sessional academic. So I was doing some tutoring, some lecturing and running some subjects for undergraduate psychology students. And then I really truly fell into an evaluation officer position just to do some research work, and that's kind of led me to where I am now. I sit as part of the practice research team, which sits in a larger unit of practice learning, which altogether we sit in the Office of Senior Practitioner, and that's for the Department of Communities and Justice. So the Office of Senior Practitioner essentially works with child protection practitioners. So in the practice research team, my job is to conduct primary research on important practice topics like improving our service with Aboriginal and Torres Strait Islander children and families, really understanding how we come to make those decisions. Another example might be understanding for children and families who are living with disability, how they might receive our service and how they might receive someone knocking on the door for the first time, and really ensuring that we're trying to keep those kids at home. So that's one area of the primary research that I do. And then another big portion of my work is conducting evaluation and monitoring projects of a lot of the projects that come out of the Office of Senior Practitioner. So the whole point of that is to understand for any programs that are being rolled out statewide, are they being implemented as intended? Are they leading to the short, long, and moderate term and impacts and outcomes that they're expected to? And we use a lot of different research methods to be able to understand that. Going through university, particularly in psychology, you tend to work a lot with numbers. It wasn't until later on in my degree that I started working with qualitative data. And what I found to discover in evaluation is the qualitative data is absolutely key. A lot of the time in evaluation research, you're working with quantitative data that you may not necessarily have set up yourself. It may not have been set up with research or evaluation in mind. So a lot of the time it can tell you what is happening, but not why it's happening. And the why it's happening is the most important part to understand what's working about a program, what's not working, who is it working for, who is it not working for, and the kinds of recommendations that we need to make. So for the most part, we do use a mixed methods approach. And the best part about evaluation is that the types of research methods and data collection and data analysis is endless. We use ethnographic approaches, which comes from anthropology, where essentially you submerge yourself and you observe how things are happening. And I've used that in evaluation of court programs before and sitting in the courts and understanding how the process works. We use quantitative data analysis, so quasi-experimental data collection and studies. For example, non-randomized cluster control step wedge designs, which essentially you're using a group as its own control, and we use those things when we can't use RCTs. We use surveys, we use program level data, administrative data, we use some forms of economic modelling to understand the cost and benefit analysis of different programs. So really, the different types and variety of your research work is endless. When I actually started an evaluation, I really truly accidentally fell into it. It was a side job that I was doing to pay the bills while I was working in brain injury research. And one of the reasons why I didn't go into brain injury research is because I really wanted to see the impact of the research that we were doing. I really wanted to see those outcomes change practice. And obviously with brain injury and with neurosurgery and neuropsychology, it can take 10 years to see some sort of change in the interventions that we provide to patients. And so I felt at that stage I was kind of looking for something else, and then that's when I stumbled into evaluation. And the best part about evaluation is that it is real-world research in real time. You conduct your research perhaps over 1 to 2 to 3 years. You put it together in an enormous report. You put those recommendations up to those decision makers, and then you actually see the impacts of your research in real time, sometimes immediately, sometimes within 6 months, 12 months. But you really feel like you're making an impact. One of the other reasons why I really enjoy evaluation is that there is so much variety in my work. I learn about a different topic for every different project. You essentially become a bit of an expert overnight, do a bit of a mental dump, and then you kind of move on to the next topic. You tend to go into certain fields and certain interests, but so far, just to give an example of some projects that I've worked on, there was a project in North Queensland in the Torres Strait Islands and Cape York, and that intervention was all about improving ear health of children aged 0 to 4 years old, because we know of the long-term impacts of hearing problems for Indigenous children. Another program that I worked on was evaluating a court program, and that was about getting defendants into support services to try to break that cycle of reoffending. Another program I worked on was an intervention program for parents who had been flagged at risk for child protection, but it was more so helping them build the skills that they need for parenting to ensure that they don't come into the system. So that alone, I've been able to be exposed to a lot of different areas, which means that my job is very interesting. With evaluation, probably one of the challenges is that you really have to be able to think on your feet and be flexible. A lot of the times you may have a deadline for a report, and there might be a very good reason for that. It might be due to a budget bid coming up, or it needs to go up to a minister. That deadline often cannot change, but as we know, things don't necessarily always go to plan in research. It might be difficult to engage stakeholders, to get enough numbers in your survey. You might not have the data that you think you had access to. So although your deadline doesn't change, sometimes the timelines do, and it can be quite squishy towards the end. So you really have to be flexible and think on your feet that if an RCT won't work, what's the next thing? If that won't work, what's the next thing? So there's a lot of problem solving that needs to come into it. Probably another area that can be challenging, it's a good skill to build, but you are often a researcher in a non-researcher world. So one of your biggest jobs is to try to take 2-3 years worth of research, quite complex research with 12 different data sources, all these different types of methodologies, and condense it into a 35-page report, which is quite a difficult thing to do, and explain it in a way that anyone can understand. So taking very complex research ideas and explaining it in the most simplest way possible. So often that can be a bit of a challenge, but it's all about research translation and knowledge translation, and at the end of the day, you walk away with a really good skill. When I first started in evaluation, I probably underestimated how much my psychology degree would actually be so useful in this job. The statistics training that you received, just even in an undergraduate psychology degree, is so valuable to those in government, in non-government, in for-profit sectors. I would say in terms of specific skills, I would say having an understanding of both quantitative and qualitative data analysis is very useful. I tend to use those skills essentially in every single project. I tend to really pair them because, as I mentioned, it's an understanding of what's happening, but why it's happening and how it's happening. And that's what the decision makers and those kind of who can push forward this program, that's essentially what they want to know. They're the questions that they're going to ask. In terms of interests, in terms of psychology, so I came from a bit of a health background, so a neuropsychology health background. And the best thing about evaluation is that you can really go into any area. When I worked in evaluation in one of my first jobs, I mostly worked along organizational psychologists, and they would apply evaluation and research methods, but to understanding workforces, understanding how workforces can improve their productivity, what's working in them, how to improve workplace culture. But then on my side, I tended to have more of the health psychology kind of projects. So a lot of things about improving service delivery in hospital systems and so on. So really, any kind of field of psychology can be applied to evaluation, and really don't underestimate your skills that psychology gives you, because as I've found, we essentially walk into evaluation ready to go. In terms of personal qualities, probably the best personal quality that you can have is organisational skills. For the most part, you don't tend to work on one project at a time. At any one point, when I was in an associate director position for Siggins Miller Consultants, it's an evaluation firm, essentially I could have in between 3 and 6 projects all happening all at the same time. I was managing 4 or 5 staff who are collecting data, writing reports, reviewing documents. So you have to be very organised to really keep track of your due dates, roughly how long things are going to take, and essentially how to manage those things when all of these sorts of things kind of come into play that really disrupt how that project is going. So, for example, with COVID-19, there was a project that relied on speaking with families face-to-face. That obviously wasn't able to happen, so you have to be able to adapt, but then adjust your timelines as well and stay organised. So I would say organisational skills is a big thing. And then project management skills. So this does tie into those organisational skills, but just being very organised in terms of your tracking of your projects, documenting everything that comes through. You can't underestimate how important it is to have things in writing sometimes, particularly if there's decisions being made about timelines and budgets about the project and scope of the project. So project management skills is a big thing, but that does tend to come with the job. I found that when I started an evaluation, all of those skills I picked up very quickly. My first piece of advice would be, don't knock back any opportunity that comes across your desk. So before you even go into evaluation, I really think it's important to look at each opportunity that comes across your desk with curiosity. I truly fell into evaluation. I had no idea what it was. I was just commissioned to do some qualitative analysis. And now I found this career path that I really value. So during my honours degree, like every good honours student, I had kind of 5-year plan for how I thought my life was going to go, and I was going to go into research and be an academic and have a certain area of brain injury research. And I came to find that actually once I got into that, this interested me more. So my first piece of advice is, any opportunity that comes across your desk, look at it with open eyes and don't kind of close yourself off to it. And then coming into the evaluation field, my best piece of advice is to network. Build your relationships. I have been lucky enough in each of my projects to work with different academics from different universities, different industry partners, different government departments. And that's actually how I came to work in the Department of Communities and Justice. They were actually my previous client. And I liked how they did things so much, and I liked that they were very honest about their work, and they really wanted things to be evaluated and wanted to improve service delivery for children and families. And I respected that so much that I actually came to work for them. And I think that really worked because I built those relationships. I ensured I stayed in contact. I networked. So that would be my biggest piece of advice.